closer to the athletes, coaches, families, and fans of Cincinnati sports. It's On the Sidelines with Q102's Molly Watson and Lindsay Patterson. Presented by OrthoCincy, the Orthopaedic Authority.
Welcome to the show. Dr. Tyler Gardner, an orthopedic surgeon and sports medicine physician with OrthoCincy Orthopaedics and Sports Medicine. Unfortunately, we have a lot to discuss today. But first, I say unfortunately because I think the whole city of Cincinnati is a little bit bummed about something called turf toe. So we'll learn more about that in a sec. But Dr. Gardner, give us a little info about what you do and tell us about your experiences with high-profile athletes.
Yeah, so I'm a orthopedic surgeon in the area. I did a sports medicine fellowship training down in Houston, Texas. We took care of all the pro teams there, so the Texans, the Astros, the Rockets, and the Dynamo. And then we also took care of University of Houston Athletics. And to be honest, when you talk about high-profile athletes, high school football down there is pretty high profile. So I took care of one of the biggest 6A schools down there, and a lot of players going Division I there. So a lot of treating these athletes basically from head to toe.
You know, it's pretty clear the Bengals haven't been protecting Joe Burrow, and that should be one of their top priorities. I think if you're on any social media platform right now, you're like, oh, offensive line, the Bengals need to spend more money on their interior offensive line and protect the franchise investment. What exactly is turf toe, and how common is it in football and other sports?
Yeah, so turf toe is an injury to the plantar plate and the capsule ligamentous process of the great toe. It's actually very common. It became more and more common after we started using AstroTurf in the 70s, which was very, very stiff, had no give. Now the turf now is a little bit better. They use, these pellets, so it's a little bit softer. But still, all that force then goes into the toe. And so, the toe is seeing more and more forces. And honestly, you can see up to 40% of NFL athletes have been reported to have this injury at some point in their career. So it's extremely common. You just don't hear about it all that often because most of the time it doesn't need surgery.
Why can it be so debilitating?
You see up to 3 times your body weight go through your toe when you're running and you're doing these explosive activities. So people might think it's just a toe, but it's very important to motion, and to the point where if this doesn't heal well, then it causes an inability to return to your highest level. Although 90% of people do come back to their normal level, so similar to like an ACL or something like that.
Okay, but in your toe, not in your knee there, which funny enough, my husband actually had turf toe years ago, not playing in a sport. He was on like a big blow up bouncy house with his son and came down too hard and injured his toe, and he did have to have surgery. Is it common for this injury? I feel like it's not, but could you explain a grade 3 turf toe that would require surgery versus a grade 3 that doesn't?
Yeah. So a grade 3 means a complete tear of the plantar plate. The difference where we go from non-surgical versus surgical would be instability. So if it's unstable, it needs to be fixed because instability leads to lack of strength of the toe, but then eventually could lead to arthritis. So basically you can look at the injury in MRI, but you really have to look at, is the toe unstable, or, is there significant injury outside of the plantar plate that's causing more instability that needs to be fixed before, letting someone go back to function.
And as far as, how long you kind of feel the aftermath of this injury, not to, bring it back to my husband, but this was years ago this happened, and he still feels a little bit of pain in his foot from this. Is that also pretty common?
Yeah, it definitely can happen. You're having surgery and there's scar tissue that can build up, which is definitely painful. And then, he might have a little bit of arthritis. He might have some subtle instability still present. He might not have had the level of physical therapy and athletic training help that Joe Burrow had, which is pivotal to recovery of any sort of injury.
Also getting back to, discussing surgery, when someone has an injury, sometimes you have to wait for swelling to go down or this, and this to happen. How soon after the injury can surgery be performed?
Usually within a few days. You don't want too much swelling because anytime there's swelling, especially in the foot, you risk infection, which is something we want to avoid at all costs. But once it's safe, then his surgery can be done sooner rather than later. It's not like the ACL where if you do it too early and they're too stiff, and it can be difficult for them to rehab afterwards. This one's more just waiting for the swelling to come down and infection risk to decrease.
When that unexpected injury gives new meaning to your summer break, just walk into OrthoCincy Orthopaedic Urgent Care. I did it a couple of summers ago. I stepped off a curb, sprained my ankle, and wore a boot for the remainder of the summertime. Hey there, it's Molly. And if you have an urgent sports, work, or everyday urgent injury, no appointment is ever needed at OrthoCincy Orthopaedic Urgent Care. Plus, they have extended evening and Saturday hours in Edgewood and Anderson. So skip the ER and learn more about OrthoCincy Urgent Care at OrthoCincy.com.
So right now, I think a lot of Bengals fans, I think you bring up a good point on it can be done in a couple days. So this happened on Sunday. Zach Taylor talked to the media today and said, he doesn't want to offer too much information. I'm sure behind the scenes they know when the surgery is going to be performed, but a lot of Bengals fans here, oh, we're losing time. Joe hasn't had surgery yet. Is that concerning that it's almost been a week and Joe hasn't had surgery, and will that impact the timeline?
I don't think that's concerning. There's a lot of logistics that go into getting a professional athlete into surgery. It's not just picking a surgeon and going forward. This is someone whose toe is worth $275 million, basically.
Yes.
So, there's agents involved, there's the coaches involved, and, there's different specialists throughout the United States that he may be sent to. And then whoever he is comfortable with, along with his agent and his coaches, they'll determine, who does the surgery. But as far as time being lost, I don't think that's the utmost concern. They're not going to wait a month to do a surgery unless there's something, a little more concerning going on. But it's probably just dealing with logistics right now and waiting for his swelling to go down.
And I know this is more of an optimistic timeline because we keep hearing at least 3 months. And right now, as a Bengals fan, I could use any optimism you could possibly give. In the past, they've said, Joe Burrow, he's a fast healer. He's dealt with so many different injuries. Unfortunately, I feel like he'll be in the medical record books one day. But is it realistic at all to even say 3 months, mid-December, or even the third week of December is a possibility he can return to play?
I think it is optimistic, but probably with some sort of carbon fiber insert into his shoe that keeps his toe stiff, there is a possibility, but you have to weigh the risks and benefits, right? Like, these are professional athletes, and they have careers that they need to think about, and they also have to be able to perform at a high level, because being a quarterback in the NFL is not a simple feat. Only 32 people at a time get to do that. So he has to be able to not only come back, but come back at a level where he will be efficient and effective.
Would you say this injury is more concerning for a quarterback versus another position player?
I think it's probably more concerning, honestly, for running backs, receivers, cornerbacks, anyone that propulsion and, fast motion, explosiveness matters. Now, he does put a lot of force into his toe, which is very important. So to say that one's better than another is not necessarily true, but there's different nuances to it. So, if you think about when you throw the ball, your toe does hyperflex or hyperextend, or dorsiflex is what we call it, the fancy medical term. So anytime the toe's in that position, he's going to be at increased risk. So it's one of those things where that's why when you look at turf toe, it can be such a severe disease, and it needs to be treated appropriately before letting someone come back.
Does it make a difference that it's not his plant foot that's injured?
Some might say so. So
Okay.
there's, you have to think about the kinetic chain. So it's his left foot, right? So it's the foot that he drives forward. And so it's not the toe that he pivots on and pushes off of. So if it was that toe, then that'd be more affecting his power and velocity. But your toe does, all of your ligaments basically show where your body is in space, and your toe is part of that. So based on some evidence, it could be injury to this part of his foot could risk some sort of accuracy issues potentially, mostly due to, off balance throws when he's pivoting off of this foot. But if you looked at the data, probably the plant foot would be worse, but it's hard to say that it really is too much different.
What precautions can be taken to help minimize this reoccurrence with turf toe?
Well, that's the hard part, right? Because you need this toe in order to function at a high level. So if you protect it too much, you could ask your husband how it felt to have that hard, thing in his shoe. Like, it is debilitating for sure. Everyone that I've had to put this into, they hate it. They learn to play with it, but they hate it. So it's a short-term thing that you can use to treat and protect, but I think long-term, he wants to not have that issue.
What's the long-term prognosis once Joe Burrow is officially healed?
Yeah. So the return to play and return to play at a high level is very good, from 90 to 70%. So, I mean, I think we can look for a good outcome. But having surgery means he had a more severe injury. So there's always, that to think about. But I think it's reasonably optimistic that he'll be back to Joe Burrow, at least at some point.
Can we just have, and I know I've already asked you for the optimism, but you said back to Joe Burrow at some point. I'm going to put you in GM instead of doctor shoes. The Cincinnati Bengals, they've managed to stay afloat. They have 8 wins on the season. It's not mid-December anymore. It's the 21st of December, which is 12 to 13 weeks later. And Joe is healed. And in the most optimistic 3-month timeline, he changes his cleats. Are you putting him out there?
I mean, that depends on a lot of factors. He has to prove to me that he can do his position in practice consistently without pain or any sort of disability. So, I mean, if he could show me that, then I'd say, sure, but I think that's pretty optimistic. But, I mean, Patrick Mahomes in 2020 played with a turf toe. Now, his was at the very end of the season, and he was definitely hobbled. So you have to look at that as well, long-term, outcome, stuff like that.
This was great.
This was great.
A lot of important information.
Yes. How you feeling, Lindsay? Feeling a little better? I know you've been worried about turf toe. No,
I'm very nervous. I'm very nervous. No, I feel great about the information we were able to get, because I think you're seeing all kinds of different timelines, and this is fantastic to learn a lot more, because I know a lot of Bengals fans are Googling turf toe this week and all the recovery, and this was a lot of important information that I think fans are going to want to hear.
Well, we can't thank you enough. Dr. Tyler Gardner, AKA Coach. We were just talking about putting you on the sidelines.
I don't know if I'm ready for that. I'm not equipped for that.
Dr. Tyler Gardner, thank you so much. An orthopedic surgeon and sports medicine physician with OrthoCincy Orthopaedics and Sports Medicine. We'll check back in with you if you don't mind. Maybe coming up in a month or two if we have more updates on Joe's toe, how he's doing. And we really can't thank you enough for taking some time out of your day and giving us this important information.
Yeah, no problem. I'd be totally excited to come back.
All right. Thank you so much, Doctor.